Before I had fibromyalgia, I was a very energetic, active person. I pretty much took care of everybody and everything. We did a lot of activities, camping and swimming and water skiing and yoga classes. I was very active in my career and did pretty well for myself. I first felt the symptoms of fibromyalgia shortly after a car accident. I had what I thought was temporary pain. After going to the chiropractor and various other doctors for a couple of years, I realized it wasn't getting any better. It's been a process of trying to figure out what was wrong with me and why I hurt so much everywhere, all over the place, like I had the flu 24/7. My limitations were a long laundry list of things, starting with basic things like I couldn't clean my house anymore. I mean, I couldn't run the vacuum cleaner without excruciating pain. I didn't want to go and do all the things I'd normally done, just social things and be around people. It's like it would just wear me out and exhaust me. The process of getting diagnosed for fibromyalgia took about 3 or 4 years and at least a half a dozen doctors before I finally got to one who understood. And I ended up going to a neurologist who did the official tender point exam. And so then I got the official diagnosis that yes, I did have fibromyalgia. It was just really frustrating to go through that. I first heard that Lyrica was available for fibromyalgia treatment from my support group, and went online and did some research to find out more about it, to try to determine if it was something that might help me. I read about some of the side effects, but I still felt like the good sounded like it might outweigh the bad, so I still wanted to try it. So I took the information to my doctor and talked to her about it and asked her what she thought, and she had heard of it and was open for me to try it. Now that I have less pain and I'm feeling better and able to do more, I was able to take stretch yoga, which has really helped me to feel better. I've learned I still can't do everything. I just have to learn how to pace myself, and I'm getting better and better at that.
Lyrica is not for everyone. Lyrica may cause serious, even life-threatening allergic reactions. Stop taking Lyrica and call your doctor right away if you have any signs of a serious allergic reaction. Some signs are swelling of your face, mouth, lips, gums, tongue, throat or neck, or if you have any trouble breathing or have a rash, hives, or blisters. Drugs used to treat seizures increase the risk of suicidal thoughts or behavior. Lyrica may cause suicidal thoughts or actions in a very small number of people, about 1 in 500. Patients, family members, or caregivers should call the doctor right away if they notice suicidal thoughts or actions, thoughts of self-harm, or any unusual changes in mood or behavior. These changes may include new or worsening depression, anxiety, restlessness, trouble sleeping, panic attacks, anger, irritability, agitation, aggression, dangerous impulses or violence, or extreme increases in activity or talking. If you have suicidal thoughts or actions, do not stop Lyrica without first talking to your doctor. Lyrica may cause swelling of your hands, legs, and feet, which can be serious for people with heart problems. Lyrica may cause dizziness and sleepiness. You should not drive or work with machines until you know how Lyrica affects you. Also, tell your doctor right away about muscle pain or problems along with feeling sick and feverish, or any changes in your eyesight including blurry vision, or if you have any kidney problems or get dialysis. Some of the most common side effects of Lyrica are dizziness, blurry vision, weight gain, sleepiness, trouble concentrating, swelling of your hands and feet, dry mouth, and feeling high. If you have diabetes, tell your doctor about any skin sores. You may have a higher chance for swelling and hives if you are also taking angiotensin-converting enzyme, ACE inhibitors. So tell your doctor if you are taking these medications. You may have a higher chance of swelling of your hands or feet or gaining weight if you are also taking certain diabetes medicines. Do not drink alcohol while on Lyrica. You may have a higher chance for dizziness and sleepiness if you take Lyrica with alcohol, narcotic pain medicines, or medicines for anxiety. Before you start Lyrica, tell your doctor if you are planning to father a child, or if you are pregnant, plan to become pregnant, or are breastfeeding. If you have had a drug or alcohol problem, you may be more likely to misuse Lyrica. In studies, a specific type of blood vessel tumor was seen in mice, but not in rats. The meaning of these findings in humans is not known. Do not stop taking Lyrica without talking to your doctor. If you stop suddenly, you may have headaches, nausea, diarrhea, trouble sleeping, increased sweating, or you may feel anxious. If you have epilepsy, you may have seizures more often. Please click on the links for the full prescribing information and medication guide.
The biggest thing I've probably learned from fibromyalgia is to pace myself and not try to do too much at once. One of the things that's been most helpful for me has been kind of a proactive approach to learning about my disease. Online you can find a lot of information, but one of the best resources I've found is a good support group, because it's really helpful to go somewhere and talk to other people who are experiencing similar symptoms and find out what they're doing that has helped them and might give you some ideas. I think it's so important to find a doctor you feel comfortable with and one that you can talk to. I have one doctor, he's helped me to learn a lot more about how to take care of my body better and to make the most of what I have to work with and maximize my health as much as possible.